is one of the biggest causes of death and illnesses in the UK. Every year, around 114,000 people die from smoking-related illnesses.
At least 50 different medical conditions, including coronary heart disease, stroke and chronic bronchitis.
Yeah, I think it's really important to keep tobacco control very high in our minds. Smoking is still the biggest cause of inequality and mortality between different social classes.
Smoking is still the biggest killer, more than obesity, alcohol and road accidents all put together.
So our region has more young smokers than anywhere else in the country, with more than a third of young people aged between 16 to 24 smoking.
So why do young people take it up in the first place?
Why did I take up smoking? I know I asked myself that question quite a lot.
It just stops me getting fat, stops me eating also.
Every one of them was trying to give up.
And now the NHS is setting up a new organisation to try and help tackle the problem.
Smokefree South West brings together local authorities, regulatory services, HMRC, police forces, NHS bodies and many national health charities in the fight against tobacco. Our ambition? To cut smoking rates across the South West and move a step closer to a tobacco-free future for all of us, our children and our grandchildren. Illegal tobacco has a current estimated value of over £200 million in the South West alone. Illegal tobacco creates a cheap source for children and young people and makes it easier for smokers to put off quitting.
But the dangers of illegal tobacco across the South West and in our local communities are really high.
It causes crime in the community. There's lots of people involved in selling illegal tobacco.
In terms of long-term aims, greater and ongoing collaborative working across agencies is important to Smokefree South West. It is the only way we are going to effectively tackle illegal tobacco, and by tackling illegal tobacco we can reduce the access that young people have to it and thereby reduce the number of young people starting smoking.
The materials that Smokefree South West provided for us have actually been tremendous in raising awareness.
Illegal tobacco is cheap tobacco, is dangerous tobacco.
I believe that the campaign has been very successful in driving intelligence. We see this as being an ongoing issue. It's not something that's going to go away just because we've run a campaign for a period of time. It is an ongoing issue and we need to address it as such.
The number of smokers buying illegal tobacco has fallen by a fifth since 2010. 61,000 people stopped smoking illegal tobacco. 100,000 fewer smokers are being offered illegal tobacco. Over 750,000 smokers claim that they are uncomfortable with illegal tobacco. And there's an 87% increase in reported intelligence from the general public.
Smoke inside your home and poisons including arsenic and cyanide.
Back in 2011, 1 in 5 people in the South West allowed smoking in their home.
Protect your family. Take the smoke outside.
If my child's toy was in the conservatory with me, she would then come and pick that up, take that to bed, and then I'm putting cyanide in her bed with her. Fine, yes, I want to smoke, I do it outside.
We were very fortunate to work with Smokefree South West and our local fire service. What we want to do is try and to promote the idea of if you are going to smoke, to go outside and smoke.
My name's Lee Wright, I work for Avon Fire and Rescue Service. Supporting this campaign is really, really easy for us because their message is exactly the same as ours. We carry out a service called a home fire safety check when we go into people's homes and we'll talk about fire safety in their own home.
Now, more than 400,000 adults and their children live in a smoke-free home.
We teamed up with Smokefree South West to not only get you to take it outside, but also give you the chance to win. Everybody who pledged either online or via the text is into the draw, and we're going to find out right now who that winner is.
We also produce toolkits to help make play parks, children's centre sites and hospital sites smoke-free.
And that's the sort of thing that Smokefree South West can do that we can't do at the local authority level. Really do that research, make sure that the signs and materials that are being developed are going to work and actually resonate with the public.
Kevin Fenton, the Director of Health and Wellbeing, Public Health England, said, "To have contributed to almost halving the number of homes in the region where smoking is allowed in such a short timescale is very impressive, and other areas could look to Smokefree South West for inspiration." A series of hospitals, children's centres and play parks in key local areas were identified and targeted as part of our work. Over half of those who visited our parks say that as a result of the programme, they are now better places to play than they were a year ago.
This is the sort of pack that we are keen they bring in, because it just tones down all those holograms, all those pretty pastel colours.
Every year, 340,000 children start smoking, and attractive packaging doesn't help. Here's what the public thinks.
They look less like cigarettes.
Looks like candy boxes, don't they?
Oh God!
We used to eat candy like this.
Stripping back our advertising to just a stark message made a bold statement in our Plain Packs Protect campaign. And it certainly made its point. Working closely with partners, Smokefree South West developed the award-winning campaign. Over 200,000 people supported proposed legislation. Now supporters of plain, standardised tobacco packaging outnumber opponents by more than 5 to 1. Over half of smokers in the South West smoke roll-ups. And many do so because they think they are better for them than manufactured cigarettes. Back in 2011, the South West had the highest rates of hand-rolling tobacco compared with any other English region. In response, we launched Wise Up to Roll-Ups.
It's healthier. Well, I mean, as healthy as you can get for a cigarette.
Some people do think roll-ups are better. They think it's more natural.
I'd say there'd be more chemicals in the manufactured ones.
Not for a minute saying it's like good for you or anything, but I always thought it was less bad for you. With all the adverts that are going around on the telly, I'm starting to doubt that a bit.
I used to manufacture cigarettes and smoke them. Which meant I'd be inhaling all the nasty stuff. You know, arsenic, formaldehyde, hydrogen cyanide, and the rest. You see, I rolled my own. And that's because I never realised they're the same poisonous chemicals as ordinary cigarettes. But thankfully, I do now.
Text WISE1 to 81066 for your free Wise Up pouch.
The campaign highlights the truth, triggering 300,000 smokers to take a step towards quitting, and an increase of 240,000 people believing hand-rolling tobacco is just as bad for you as manufactured cigarettes. Smokefree South West has backed many national initiatives, including Stoptober. In the last year alone, we've achieved over £2 million worth of PR coverage, ensuring the South West really is hearing what we have to say.
Well, it's been fantastic working with Smokefree South West. We wouldn't have achieved our target this year.
We already have so much to celebrate, but there is also a long way to go.
We need to keep driving down smoking rates, and tobacco control's new home in local authorities does present us with a tremendous opportunity to both innovate and introduce new partnerships. 4 out of 5 smokers started as children, and 2/3 of smokers regret starting and don't want their own kids to start. We need to protect our children from smoking and becoming the next generation to live with the long-term consequences of tobacco use. And we need to go further. We need to create the first smoke-free generation and make smoking history for our children.
Thanks to you, our partners, we can all be proud of the successes we've achieved by working together. With your support, we will continue to build on these successes and get one step closer to reaching our ultimate goal of making smoking history for our children.